To help understand the effects of bed rest on physical performance in athletes, Barry Spiering and colleagues conducted a systematic review. Regarding the study criteria, studies were only included in the systematic review if they involved healthy adults between 18 and 50 years old, who are classified as Tier 3 to 5 athletes, meaning highly trained to world-class level. Studies must have involved horizontal bed rest for the entire length of the protocol, lasting at least 72 hours, and did not involve incline or decline of the bed at any point. Objective measurements of physical performance, like VO2 max, also need to have been reported before and after bed rest. If studies satisfied all the criteria, however did not involve Tier 3 to 5 level athletes, they were made a note of but not used in the systematic review. Unfortunately, no studies met all these criteria and looked at the effects of bed rest in Tier 3 to 5 athletes. However, 7 studies were found that involved Tier 2 participants, meaning trained individuals who regularly train 3 or more times per week. These 7 studies were used to provide narrative insights around how physical performance might change after bed rest. In some cases, data from recreationally active, Tier 1, or sedentary individuals, Tier 0, were used sparingly to fill knowledge gaps when data from Tier 2 individuals did not exist. Therefore, this presentation will be a short summary of Barry Spiering and colleagues' narrative review. First of all, regarding the effects of bed rest, based on the evidence in healthy but non-elite athletes, endurance performance drops within 3 days, largely due to plasma volume loss. And regarding muscle strength, this decreases within 5 days, which is linked to decreased neural function and muscle atrophy. And indirect evidence suggests the more trained you are, the more you stand to lose. And regarding countermeasures, when training isn't possible during bed rest, some non-exercise strategies might help to reduce performance loss. Fluid and salt supplementation is the most promising for maintaining endurance, as it helps to preserve plasma volume. Other countermeasures that require further evaluation include passive mechanical loading, protein supplementation, motor imagery training, passive blood flow restriction, electrical muscle stimulation, lower body negative pressure, anti-gravity suits, which add resistance at the knees and ankles, and pharmacological interventions, but these carry ethical and doping concerns and are not generally recommended. However, it is recommended to combine multiple countermeasures, as this is likely more effective than using just one in isolation. In terms of recovery from bed rest, following bed rest of 28 days or less, at least 2 to 4 weeks of progressive rehab that includes strength training is recommended to help restore physical performance. However, the exact recovery timeline should be individualized based on the reason for bed rest, for example, illness or injury. So when it comes to key considerations, no direct evidence for how bed rest affects elite athletes exists. Current recommendations are based on primarily Tier 2 individuals, so there's a need for research involving bona fide athletes in order to help guide return to sport timelines, as athletes might be more susceptible to the negative consequences of bed rest and may need longer recovery. And that concludes this presentation. As always, I recommend you go and check out the full article. The link is in the description. Thanks for watching, folks. See you next time.